Donanemab is an experimental drug that targets a modified form of amyloid-beta, a protein that accumulates in the brain of Alzheimer's patients and is thought to cause neurodegeneration. Donanemab is an antibody that binds to a specific epitope of amyloid-beta and triggers its removal by the immune system. By reducing the amount of amyloid-beta in the brain, Donanemab may slow down the progression of Alzheimer's disease and improve the cognitive and functional abilities of patients. Donanemab has been tested in a Phase 2 clinical trial involving 257 patients with early symptomatic Alzheimer's disease who had both amyloid and tau deposits on PET scans. Tau is another protein that forms abnormal tangles in the brain of Alzheimer's patients and is associated with neuronal damage. The trial compared Donanemab with placebo, administered intravenously every 4 weeks for up to 72 weeks. The primary outcome was the change from baseline in the score on the Integrated Alzheimer's Disease Rating Scale, IDRS, which combines measures of cognition and daily activities. The trial results showed that Donanemab was superior to placebo in slowing down the decline in IDRS scores at 76 weeks. The difference between the two groups was 3.20 points, which was statistically significant, p equals 0.04. However, most secondary outcomes, such as the Clinical Dementia Rating Scale Sum of Boxes, CDR-SB, the Alzheimer's Disease Assessment Scale Cognitive Subscale, ADAS-Cog13, and the Mini-Mental State Examination, MMSE, did not show significant differences between Donanemab and placebo. The trial also showed that Donanemab reduced the levels of amyloid and tau on PET scans by 85.06 centiloids and 0.01 units, respectively, compared with placebo. Donanemab was generally well tolerated, but it caused some side effects, mainly related to amyloid-related cerebral edema or effusions, ARIA. ARIA is a common complication of anti-amyloid therapies that involves swelling or fluid accumulation in the brain. Most cases of ARIA were asymptomatic or mild, but some required dose interruption or discontinuation of Donanemab. The trial concluded that Donanemab had a beneficial effect on cognition and function in patients with early Alzheimer's disease, although longer and larger trials are needed to confirm its efficacy and safety. Donanemab represents a promising new approach to target amyloid-beta in Alzheimer's disease and could potentially change the future of its treatment.